Hey everyone, it's Lisa with Hope for SD. It's time for another video on clinical trial education, what's out there for all of us to participate in. And this is another study that includes both children and adults, and I'm actually really excited about this one because we're participating in it. It's based on decision aids in sickle cell disease. So right now, as parents or as patients, when we're presented with a decision, this study specifically is deciding whether or not you start on hydroxyurea or whether or not you start on looking on going into the BMT, bone marrow transplant process. The information we get right now, it's not universal. It's not the same at every hospital. It's almost all just text. And, it's kind of spotty depending on where you're at. Some places give you tons and tons of information, and some places give you just kind of a simpler version. So what they're doing out at Emory University in Illinois is they're trying to create some decision aid tools that could help us have a broader view of kind of all the different pros and cons and what other people would have said about what's happening. So although it's based in Illinois, actually you can participate anywhere in the country, so that's really exciting. So it's both genders. They have the age range as 8 to 80 because 8 being the youngest that an actual patient could participate, and if the child's younger than 8, then the parents just participate because obviously they're the ones that are making the decisions completely below that age. So you would just be then a parent of a child living with sickle cell. All forms of sickle cell disease are included, and you have to have not started either hydroxyurea or the BMT process. You could have already been on hydroxyurea and then stopped taking it, or started looking at the BMT process and then kind of backed out, but you can't be actively using or participating in either one of those treatment options. Told you where it was based at, so all of us around the country can participate. And I'm just going to read you the objective, and then I'm going to kind of explain it, because it's actually really, they're doing a lot of interesting things, but it was kind of hard to explain all in one video. So here we go. Their objective is to develop and implement a web-based decision aid individualized to patient characteristics to help patients and families achieve a more accurate perception of risks and benefits of treatment options and make decisions that align with their values and preferences. And so that is a really huge weighted objective, which I'm really excited about because just in plain you and me English, it's, they're creating this online decision aid, so something that helps you to really make an educated, informed decision. And not only are they just giving you the information, but they're also personalizing it to what's important to you as a family, as a patient, what your values in your healthcare is important, what your preferences are in your healthcare. And that's really, really exciting because that's just groundbreaking. That doesn't happen right now. Part of what they're doing, and part of what they had asked me as a family member originally, and way back when I just kind of randomly talked to them at a conference I was at, was if I would be willing to tell my story of what experiences we had with hydroxyurea. And it was interesting to me that they even asked that, because although we think that everybody should try hydroxyurea as a patient just because it's the only drug out there, so we should give it a go. It actually didn't work for Sophia, and it wasn't because she had any crazy side effects or anything like that. It just never resulted in a decrease in pain, and so they really wanted to have a video of both the pros, so parents that are like, this was a great drug and it really helped my child, or as patients, I have a less acute chest syndrome and whatnot, and then to also have parents who can clearly articulate, hey, this didn't work for us, here was our experience. And so you have both sides of the story, so to speak, from parents, also what the doctors are going to tell you, the medical part, so making that really clear for patients and their families, and so we can all understand how the hydroxyurea works and how the BMT process works and what that looks like, and have some different videos on that. And then when they talk about individualizing it, how they do that is by you're filling out a ton of surveys online, and they're asking you questions about how you make decisions, how you prepare to make decisions, what kind of knowledge base you have in these areas of sickle cell, which I think for all of us would be, we only kind of know things as they're presented or as they come up in our child's lives or in our lives if we're the patient. And sometimes hydroxyurea, I know in our case for hydroxyurea, just took us by storm. It wasn't even on the horizon. And then she had enough pain crises that all of a sudden, like in an inpatient discharge, it was there. We want to start Sophia on hydroxyurea. And both Sean and I were, talk about decision making. There was no aid. It was, this is what we want to do. And you're walking out the door and they're handing you a prescription. And then they handed us some information. And the goal of this study is to really make it to where if that happens and you're in that situation, that you have this decision aid tool where you can just access it and get all the information, and it's online so you can access it anywhere. So that's really exciting. I urge you to participate if you are interested in being a part of that process of creating those decision-making tools. The contact this time is not a doctor. It's, I believe she's a nurse. Her name is Diana Ross, like the singer. I'm sure she gets that all the time. Sorry, Diana. Diana Ross, yep, she's a nurse, and her phone number is 404-727-9783. Her email is also down below, and I spoke with her at length in April at the FSCDR conference, and she is more than willing to work with people all around the country and people that have both been through the process and what your experience was, and people that are, thinking about or not thinking about the process and haven't started it and want to be a part of creating the decision aid tools. So check it out. And remember that everybody from all around the country can participate. So stay tuned for another one tomorrow. Thanks. Bye.